Hello everyone, it's Women's Health Week and I'm excited today because we are going to have a special guest visiting us at Dietitian for Mums. Her name is Catherine Chong. She will be joining us very soon. I just want to say to every woman, this is your week to really look after yourself and here's Catherine. Hey, Catherine. I'm just waiting for Catherine to join. There we go. Beautiful. Catherine is just joining us now, and we're going to be talking about ovulation induction.
Hello. Hi, Laura. How are you?
I'm great. Happy Women's Health Week.
I know. It's a fabulous time to celebrate for all women, isn't it?
Yes, it's fantastic. And what a great job that we have where we actually specialize
Mm,
in women's health and that we get to help women make these changes to
yeah.
their health, but also their fertility.
Yeah, absolutely. That's why we're so passionate about the area that we work, isn't it?
Yeah, yes. And Catherine, just so that, everyone knows a little bit more about you and what you do.
Yeah.
You are my colleague, yes, a Nutrition Plus member, which is a group
hmm
of dietitians who, it's an international group now, where
Mm,
we specialize in fertility and pregnancy, nutrition and reproductive health. So you've got lots of experience in and with a special interest in PCOS and also IVF. Is that right?
yeah, that's absolutely right. So Laura and I, it's one of the nutrition plus dietitians. My area of interest is specializing in fertility and also IVF nutrition. And we're currently based in Brisbane and consult to medical practice, but I also do my own virtual consultation as well, seeing clients from all around the country.
Amazing. That's so great. You can see anyone from anywhere, really.
Yeah,
Yes.
absolutely.
And I thought you are the best person because you do have this special interest in IVF to talk to us
Mm,
today a little bit more about ovulation induction because
mm,
it's a common sort of first step um,
yeah,
type of treatment and one
yeah,
that a lot of women who have PCOS sort of that's one of their first steps in starting to take fertility treatment. So
yeah.
do you see a lot of your clients undergo ovulation induction?
Yeah. So I suppose that a majority of clients that often get referred by fertility specialists or even GP as well to me, it's PCOS, like polycystic ovarian syndrome,
Mm.
who needs to go on ovulation inductions. And also another, I guess, group of clients that often see it's the IVF treatment, right? Then they need to prepare them for the 8 week retrieval. So there are two major group of clients that I tend to see in my practice.
Yes, same. I have a lot of
Hmm.
questions from women who are about to undergo
Yeah,
freezing as well, and
yeah,
that, yeah, and
that's
then
right.
wanting to know, how can we improve the success of these treatments? Is there
Yeah.
that we can do? Like, is there anything that we can control when we are going to undergo some, fertility treatment? And the answer is yes. So
Of course, yeah,
yeah, the answer is yes. And diet can
yeah.
play a really important role. And we're going to discuss some 5 tips today that are going to help. It might be a little bit more than five because this is a juicy sort of topic. Um, yeah, but I guess ovulation induction, for those who don't know, is where you will undergo some treatment where you will take some hormone
Mm,
medication, either orally
yeah,
or by injecting. And
yeah,
what that does, it stimulates your body to produce through the follicle stimulating hormone to actually develop the follicles and so that they're mature enough and then they'll and then ready for ovulation. So that happens on the 5th day of your period. You will take some hormone medication, and we expect ovulation then to occur about 5 to 10 days after. So that's generally what ovulation induction is about. When women go for ovulation induction, the first thing that they come to me and ask is weight something that they need to consider? So is weight important when we're thinking about ovulation induction?
Yeah. I guess that this is such a great question. So, if you're someone who's trying to have a baby, weight certainly is an important factors that we're looking at it. The reason why is because if you're having, say, for example, too high of body fat level, or even if you have too low as well, it can impact on your fertility and the chances of you having a successful, ovulation induction or a successful pregnancy. Now, the latest study actually shows that if you are carrying, say, for example, a higher amount of body fat level, it tends to also respond poorly as well to the ovulation induction medication such as Clomid, or you may require a higher dose of that hormonal injection as well to help to stimulate the egg production. Most importantly as well, we know that the impact of weight itself also has a role in terms of affecting the embryo or the egg quality. So to answer your question, Laura, yes, it's incredibly important factors that we look at when helping women to prepare their body for pregnancy.
Yes, and I guess we also know that having extra body weight can cause sort of DNA issues as well. So it's important for egg health that we optimize body weight. For some simple tips, I guess you could also work out your BMI, and you can do that just by jumping on to the internet, and there's lots of calculators out there, and just getting a gauge what your BMI is, because like you said, it could be too low that you need to actually work on gaining some healthy weight, or if it is higher. So a healthy weight range, the BMI is between 18.5 and 25. So if it's outside that, it's a good idea to know how much outside that is, and potentially what you could do at home. So you can increase your physical activity that's within your control, modifiable factor. You can also look at apps like these. There's lots of free apps where you can track your calories and just try and be a bit more aware of what you're eating. So when you track your calories, it just kind of helps you just see where the calories are coming from. Because there may be room for modifying your diet. It might be that you might have some soft drinks that you have in your diet, and by actually tracking them, you can see how much that's contributing to those extra calories, or those snacks that you think that they're healthy and they might not be. So we know that by tracking your food and being a bit more aware of your food, that brings awareness and does help change. But I guess the limitation of a BMI result is that it doesn't tell you much about how much body fat you have. And that's the key thing when we're looking about egg health and some of the reasons why body fat can impact egg health. So a fertility technician like myself and Catherine, we can refer you to do a body composition scan, and that tells you a lot more about the body fat, and particularly if someone does have a healthy weight and is within that healthy weight range, but sometimes they do have a high body fat percentage, and that's something that we can work on. We want to be seeing a fertility dietitian 1 to 3 months beforehand to have the best results. So these are some of the strategies that we will look at to optimizing your body weight. Do
Mm.
you have any, yeah, what are your thoughts about that?
Yeah, I was going to mention that we don't just often look at the BMI because certainly in my practice, I do have a body composition scale. So what I tend to say, some women, even though their BMI is normal, but when you look at the body fat percentage, it could still be falling too low or can still be, falling too high. So absolutely, I think at the individual level, a body composition scan could be a useful tool to assess that.
Mm-hmm.
The other thing is I want to say that the good news is, research shows that even just by losing that 5 or 10% of weight, it definitely will increase that chance of the ovulation induction success and also help with boosting that fertility as well. So I think that if the time, allow a month before or up to about 3 months before, that will be a really great time to look at how we can optimize the chance with a natural approach.
Yeah, absolutely. And
Mm,
like you said, especially for women with PCOS, it's 5 to 10%
yeah,
reduction in body fat can make a really big difference to their
yeah,
hormones and actually help them to ovulate naturally.
yeah,
And of
yeah.
course, improve
That's for
ovulation
sure.
induction success. But that shift in body fat can make a big difference, and it doesn't
Mm,
have to be a lot. So, yeah, great point. But I guess for some women, particularly women with PCOS,
yeah,
they could be doing all the right things,
yeah.
and still not losing weight. And this could be because their hormones are out of place, particularly one that is called insulin. So if someone does have insulin resistance, it can be working against them to optimize their body weight. Do you have any tips around that?
Yeah, of course. I guess like, when I first, quite often when I first met my PCOS client, it's one of the biggest struggles they always say to me is, Catherine, I'm just really struggling to losing weight. I'm not getting my period. So
Mm.
this is some of the really obvious symptoms. So, the first step is we really need to help these women to improve their insulin hormone. So why? Because insulin is a hormone that responsible, first of all, is to regulate that blood sugar level. Now,
Mm.
for women with PCOS, it is harder for their body to process that sugar load, also known as insulin resistance. So the problem here is the more insulin level your body builds up, the more release of that meal type hormones, also known as androgens, they are releasing your body, and hence your body may stop ovulate and also might affecting the growth of the egg cell as well.
Mm.
So definitely the first step working with PCOS client is we want to treat the root causes.
Yeah.
So then in terms of diet strategies, we'll be looking at, okay, how can we improve that quality of the carbohydrate foods and also the quantity as well. So in this case, we're talking about can we get the clients to choose more low GI food. So basically, it's the lower the GI, so glycemic index is,
Mm.
um, the slower the release of that carbohydrate foods in your body, and then it helps to treat the insulin hormones better. And also potentially we're looking at can we reintroduce more the whole grain foods, so whole grain carbohydrates. Example like raw oats, quinoa, barley, buckwheat, or brown rice, for example. These are all the kind of less type of refined type of carbs, so really close to the nature as possible. It also fantastic. It felt with a lot of fertility nutrients, such as the B vitamins, antioxidants. It's all essential as the foundations of the fertility diet to give it another boost to increase that ovulation induction success.
Yeah, absolutely. And it can help,
Hmm.
energy, mood, and
Yeah.
and some of those symptoms that come with having insulin resistance and those feelings of, feeling hungry or intense
Mm.
sugar cravings. It can carb out all of those
Yeah.
symptoms that are really problematic for someone who has PCOS.
Yeah, for sure. And just an interesting study as well. What I came across is also a study report that if you do include like more frequently whole grain foods, it does also maximize that chances of implantation.
Yes.
And also it can potentially increase the endometrial thickness as well. So which is fantastic for women who needs to undergo ovulation induction or IVF. So certainly whole grain is something that we will need to address or need to improve on in terms of the diet.
Yeah, and quinoa is such a great example of whole grain
Mm.
that I think it's really easy to prepare, and you
Yep.
make a large batch of it, and you can use it for lunch or dinner, and you just pull it out from the fridge, and it lasts a few days in the fridge. So it's a really quick and easy thing that you can
Mm.
either sprinkle on top of salads or
Mm.
yeah, make that the main dish either by combining it with rice, lentils. It's really versatile. So if you're thinking how you can increase your whole grains, I definitely recommend trying some more quinoa, because I find that's really easy in my household to use.
Yeah, it's definitely one of my favorite as well.
Yeah, yeah. Well, the other thing that is important
Mm.
for ovulation induction is improving egg health,
Mm.
and
Yeah.
yeah, we know that we can't increase the amount of eggs that women have, but we know that we can improve their egg health. And one of the big things that I come across with my clients,
Mm.
particularly women who have PCOS, is that they're low in vitamin D. And
Yeah.
yeah, and so an interesting Italian study showed that women who had adequate vitamin D actually had improved fertility outcomes, including success of IVF. So this is something that is really important, often can be missed. Getting a vitamin D test, a fertility dietitian will
Mm.
be looking out for these kind of things depending who is coming through the door. But vitamin D is something that we need to optimize. It takes a bit of time to boost those vitamin D levels, and
Mm.
so through a blood test, we'll know just how where your levels are at, and depending on how deficient you are, we will tailor that supplementation, the dosage to you. So it's got to be supplemented correctly. I think
Mm.
the part of a lot of the fertility diet and supplements information is all very valuable and fantastic, but we need to make sure that it's tailored and we're getting the right amount, the
Yeah.
right dosage for the person to make the best impact, I guess. The other thing that
Yeah.
yeah, the other thing that's really important for optimizing egg health is just the quality of your diet. You touched on antioxidants. So
Mm.
that's really important. Antioxidants can help with free radical damage that sort of damages that can damage egg health and increase inflammation. And I know you're going to talk about inflammation, so I'm not going to go into that too much, but
Yeah. Yeah.
increasing color in your
Mm.
diet, trying to eat a lot more of eat the rainbow. I think lots of us have heard that term, but the more colors that you can have on your plate, aim for 3 different colors at each meal time if you're having 3 meals. That's a good way to sort of up the antioxidants. The other one that comes to mind is making sure you're getting enough zinc. So zinc is really important for fertilization, and there's this surge just before, yeah, this surge and an increased need for zinc just before fertilization occurs. So, and one that I really like to recommend to my clients is getting enough having some oysters, and
I
that's
thought.
always something, yeah, a little bit special that you can do with your partner.
Yeah.
Having a
Yeah.
special sort of meal together, I would recommend having a bit more oysters. Zinc is hard to test in the blood. We analyze that through
Mm.
diet.
Got it.
So
Yeah.
it's yeah, it's so that's another example where diet's really important. But like I touched on just briefly, antioxidants can really help mitigate some of the damage of free radicals. Do you have any tips on how to boost your antioxidants and reduce inflammation and therefore help with egg health?
Mm. Yeah, I think another great nutrient that I will look at is omega-3. So
Mm.
omega-3, it's really a quite well-researched nutrient when we're looking at fertility, ovulation inductions, or even IVF. So basically, we know that the follicular fluid surrounding what we call the oocyte, so like the egg cell, it has this omega-3 um, within that follicular fluid. In fact, it's quite a higher level. So what the researcher was, showing is that omega-3 may potentially helping the egg cell to protect from that free radicals, from the oxidative stress, and also the environment factors. So definitely it's one of the nutrients I'll look at, when I'm consulting clients. So what we're talking about here is the omega-3. It's a good healthy fat. So commonly, the greatest source of omega-3 is coming from oily fish, such as salmon, trout, sardines, or mackerels. So these are known as the oily fish. Now, if you're not a fan of this type of fish, there are some white fish such as John Dory, snappers. That's still a great source of omega-3 here. So where we're looking at it right now is the recommendation is to enjoy 2 to 3 servings each week. So each serving is about 150 grams of fillet to help you to boost that omega-3 level. Now, Laura also touched on a little time, working with fertility dietitians is all about customizing, right, the plan for the clients, right? So I guess that,
Yeah.
in terms of omega-3, the advantage of seeing a fertility dietitian is we will be able to sit down with you, have a look at, okay, the quality of a diet, how often do you have omega-3? We may also consider to recommend you like omega-3 testing to have an, exact number showing us that how is your body absorbing this omega-3? Are you having enough from diet or do you need additional supplements? So definitely, I guess, omega-3 definitely works well to help to boost or to give that anti-inflammatory, effects. Yeah, so that is something that I will be looking at it as well.
Yeah, absolutely. And I love that you touched on the omega-3
Mm,
tests because that gives us a really good idea where you're at
yeah,
and how to dose your omega-3 supplement to actually
yeah,
boost it to get to where we need to
yeah,
optimize our stores. And also then
yeah.
it will help to optimize the fertility treatments that you're going to go through when your nutrition
Mm,
stores and we're driving down inflammation. They're all
mm.
beneficial towards improving the success of any of your fertility treatments and conceiving naturally.
Yeah, that's right. And it generally takes about 3 to 4 months to optimize that level. So certainly the earlier you can get started to improve your diet, the better, but also it's never too late to get started for sure.
Yeah, that's right. That's right. It's never too late because, yeah,
Mm,
all these dietary changes that we talked about do have an effect. All of them have different time slots that will have the best sort of
yeah.
the impact, but it's never too late. Anything that you are going to try to do, all these things will benefit your health in one way or another.
Mm,
So definitely get in contact with myself or Catherine if you have any questions about your unique condition or your journey where you are in your fertility journey, and we
mm,
will yeah, we can answer your questions and we can also help
yeah.
by working with you one-on-one. We both have some programs that are tailored to fertility and
Mm,
is, like you said, Catherine, online. So very accessible and very beneficial if you are going through ovulation induction soon. I do want to touch on
yeah.
one more thing, Catherine. Do you we had a question that came in a little bit earlier
Okay.
and said,
Yep.
should should I continue to take my inositol if I'm undergoing ovulation induction? What are your thoughts about that?
Yeah, really good question. So, um, I don't see, I mean, you can continue with inositol supplements. The only thing that you need to be aware is that, if you are taking, like, say, a diabetes like medication like metformin, at the same time with inositol supplement, you just got to make sure that letting the doctors know, because there's also a potential risk of your sugar levels running too low as well, because myo-inositol, one of the advantages, it may help to improve the insulin resistance. Yeah. So that's the only things I can think of right now. And I think the answer is yes, you can continue to take it through.
Yeah.
Yeah.
I guess working with a fertility dietitian will just determine if you really need to or not.
Yeah.
That given the background, have a little more background information. But generally speaking, it would be okay. It's just of those low blood sugar levels. But yeah, it's definitely something to have a better look at with a fertility dietitian.
Yeah.
We have had a couple more questions come in.
Yeah.
We've got one that says, what's the difference between a high extreme omega-3 oil or the triple strength fish oil omega-3s?
Yeah.
Well, it really depends, because these sort of terms are sort of marketing terms. Yeah, so it really depends, because we don't know what's in this fish oil. A high extreme omega-3 versus a triple strength. To me, it sounds like these are just marketing terms to sort of suggest a high dosage omega-3. So that's what I without knowing the brand, without knowing what's in it, that's my initial thoughts. What are your initial thoughts, Catherine? Have you come across triple strength?
Yeah. So I guess that so when you're selecting the omega-3, first of all, don't just look at the front of the packaging. Like Laura said, it could be just some sort of marketing message. So it's really the key thing is you want to have a look at the back of the nutrition information. So look at, when we're talking about omega-3, it's how much EPA and DHA it contains in that package itself. And again, working with a fertility dietitian, will be able to work out, do you just need a standard dose, or do you need a high strength to give it another boost of that omega-3 level? Yeah.
When it comes to supplements, it is a bit of a field if you're just going to the supermarket or the chemist to determine, because they do use these sort of tricky terms like, triple strength and extreme. But what does that actually mean? We will look at the amounts and type on the back, and then we'll work that out for you.
Yeah. And the other thing is, not everybody suits to take a high strength omega-3 as well. So certainly, it would be best to check with the fertility dietitian.
Yeah, there are some medical conditions where we wouldn't. That's right. We'd love your insight on the vaccine and fertility.
Wow.
From what I understand, that there isn't an impact on fertility. But again, when it comes to the vaccine, this is something that you should discuss with your GP or your fertility specialist, because it comes with medical history, not more than anything. It's not specifically related to fertility. It's more so your medical history, and discussing that with your GP is the best answer that I can give.
Yeah.
And we've got one more question.
For
embryo transfer preparation, which one should I take? Do you mean, Lauren, do you mean about your omega-3s? If you can, I think that's what she means. Yes. I think that's what you mean in terms. Yes. Would you have any recommendations about omega-3s
for omega-3?
Yeah.
Again, it really depends. I suppose that, not everyone we will put on supplements. So I guess the first step is, are you having enough of fish in your diet, or do you enjoy fish? Um, yeah, if you don't meet that, through the diets, then you may require that supplementation.
Hmm.
Um, yeah, so it really depends on, I guess, how's your diet. But yes, if you are lacking in omega-3 in your diet, I would definitely suggest to do the supplementation. Um, but another important things to note is that before that ovulation, induction or even egg retrieval procedure, um, sometimes, I mean, not sometimes, most of the fertility, specialists, they may advise to also stop the omega-3 a week before, just that it just want to minimize the risk of bleeding as well. That's
Yeah.
why, again, it's very hard to advise you, Lauren, right now, but reach out to one of us. We'll be able to, direct you to the right directions.
Yeah, it's so hard to give individualized advice because
Mm,
it really depends on your timeline, your blood work, what that says. Do you eat fish or not? But we
yeah.
do, and your medical history. But we do recommend having
Mm,
a oily fish 2 to 3 times a week. If you do anything, if you want to take any steps, really focus on your diet, and try and include more of those oily fish if you can. If fish is not a thing that you do eat, then supplementation does become more important, and either
yeah.
myself or Catherine can definitely help navigate that for you. Yeah.
Yeah. Awesome.
Yes,
Oh,
thank you for everyone for your questions. Just give you a couple more minutes if anyone has any
okay.
other questions that come up. I've really enjoyed your questions. They were great questions, particularly around omega-3.
Yeah.
I think there
Yeah.
is a little bit of, the message is getting out there that omega-3s are important for inflammation and egg health.
Yeah.
It is, the tricky part is, yes, tailoring it to the person and making sure that it's the right dosage and the right type.
Yeah. As
Yeah.
well. Yeah.
Yeah. I don't see any more questions. I hope I haven't missed anybody. But again, like I said, just reach out. Catherine, do you want to tell people where the best way to reach out and to contact you is?
Yeah, sure. You're more than welcome to send me a DM on Instagram. I do also have my YouTube channel as well, a dietitian Catherine Chong, where I release weekly YouTube video as well, sharing with you all the information about fertility. So you could also connect with me there as well.
Excellent. It's a great channel, so check it out. You can find all the tips from today at dietitianformums.com.au
Mm.
under resources. It will be put up later this evening or early tomorrow morning.